This lecture is going to be kind of your preclinical survival guide to matching EM. We'll take a second really quick and introduce, I see some members on the board are on the call, so I'll let everyone who's on just go ahead and introduce themselves, so anyone can start.
Hey guys, I'm Coral. I'm the president of the RSO. I've been here for like 5 years now. Lovely to meet you guys virtually.
Hi, everyone. My name's Miranda Kennedy. I am another conference chair. I am a second year and I go to KCU.
Awesome. All right, so we'll get started. This is kind of, I thought would be helpful to look at the timeline for emergency medicine if this is something you're considering. Working through each of the years, starting off with your OMS one, which I'm not really sure kind of which students we have here, but the first kind of goals of OMS one, it's your first year of didactics, you're getting used to medical school, the studying, the rigor, pretty much how to medical school. A big thing for you guys to make sure that you're doing is joining your EMIC, getting involved in emergency medicine early on, meeting people with similar interests, and then also getting involved with mentorship series like these through our DOSAs, getting involved in your both academically, outside of academics, and we're going to go into a little more depth about that as we move through the presentation. And then also attending conference. And you can see that's kind of across the board something you should be doing. We'll talk more about that. Second year, you're going to continue through didactics, continue your involvement in your extracurriculars, start kind of tailoring your CV and starting that personal statement, kind of deciding how you want to look when you're applying to these programs, and then also start looking at where you want to live. I was given the advice by actually Alex when I was a second year of how should I be looking at residency? How should I be making this list? Is it too early? Is it too late? And always a great place to start is where do you want to live? East Coast, West Coast, North, South? Where's your family at? Where's your support system at? Is there a place that you've always wanted to live or something like a dream state that you've wanted to live in? So these are great ways to kind of start funneling down that very giant list of all the different programs that you can decide. So that was a great way that I started looking at it. Also, attending conferences really big second and third year going into it. And then you're also going to be taking boards, which is just a favorite of all of ours, but that is also a really big milestone. Third year, you're going to start clinical rotations, which is always super exciting, but also a really important step of kind of increasing your clinical knowledge, getting comfortable with procedures and kind of honing in on those skills that are really kind of important for emergency medicine. Third year, you should start having that list of programs. I know our VSLO just opened, which we'll go into in a little bit about what that is. If anyone hasn't heard of it, it's okay. If you're a third year on here and you haven't heard of it, we should chat because we're all doing it right now and it's great. But and then you're also going to take boards round 2 in the summer. And then fourth year, you're going to be going through your audition rotations and your sub-Is. You'll interview and then you'll have match. And that's coming up for a couple of our fourth years, which is really exciting. That's kind of the timeline about what that looks like. And we're kind of going to be focusing on that first year specifically and also second year a little bit.
All right, so I know myself as a first year, I was very confused by a lot of the terms thrown around. And even though a lot of these terms you don't really need to use until, second year, third year, for you first years on here, I think it's a good idea to just have a foundational knowledge of some of the terms. So the first one is VSLO, also known as VSAS. It stands for Visiting Student Learning Opportunities, and this is basically the platform we use to apply for rotations for fourth year. There's a couple on there that you can apply for third year, but it's most commonly used for fourth year. And there's also another platform called Clinician Nexus, and it's the same type of idea, only a few programs use Clinician Nexus. VSLO is definitely more common, and it's also a platform to apply for rotations. VSLO and VSAS are run by the AAMC, which you guys should be familiar with. A sub-I is a sub-internship, and this is usually a requirement by your school directly, and each school's criteria is different. So, for example, mine at Western University, it has to be 75% inpatient, you have to have residents at the program, and you need to participate in direct acute care. Auditions and away rotations are used synonymously. It's basically a fourth year rotation out of residency program that you can see yourself matching in. The current CORD guidelines, which is the organization who kind of tells EM students what to do every year, suggests doing 2 to 3 auditions, and these are usually done between like August and November, October. ESLO versus letter of rec versus letter of intent. So the ESLO is a standard letter of evaluation. It has to come from an emergency medicine residency program, and you obtain your ESLO during an audition rotation. This is one of the most important parts of your residency application. And a letter of recommendation you can also add on to your residency application. You can use it to apply for audition rotations. Some schools require them and some schools don't. Letter of intent, also similar. Like right now I'm applying for rotations for my 4th year, and I've already had a couple programs have a requirement for a letter of intent, and you kind of just write why you want to go to their program. ERAS is the Electronic Residency Application Service. This is what you use during your 4th year to apply for residency. Something that I didn't know that I started doing probably last fall was that if you want to use the same letter for VSLO to apply for rotations, but also want to use that letter for ERAS, they need to be uploaded separately. It's 2 different uploads. So make sure your letter writer knows that. This is kind of far in advance for you 1st and 2nd years, but I thought I'd just introduce it so you hear these terms and you're not super confused like I was.
So here's just some general advice that me and Amber and a couple of the other people kind of thought were good to kind of state. First of all, balance your lifestyle, make time for friends and family. You're a student, but this is also your life. So make sure that you have hobbies and niches. You can deep dive, stay committed to those things. If you like to hike, go hiking. If you like to cook, bake a bunch of stuff. The thing about EM is they love hobbies, and that's a trend that you'll see in interviews. They want to know that you're something outside of medicine. They want to know that you have something outside of just your career that can fulfill you. You can kind of de-stress, do whatever you want. And this can be anything, even if it's something you may say, oh, I don't know if I should say that, or on an audition or on an interview. Say it, because it's you and you need to be authentic, and they love it. And it's usually, from what I've heard from 4th years, what's asked about the most. If they say, oh, you like to bake, like tell me more about that. Like, oh, you like to run marathons, how many have you run? Sometimes that's more of the topic of conversation than your board scores and academics. Speaking of board scores, don't stress too much, especially 1st years, about step 1, level 1, and step 2, level 2. Those will come. Study for your classes is studying for boards, is what I was always told. And especially if you're kind of a 1st year, just focus on kind of getting acclimated to medical school. They are important. Don't brush them off. The average step 2 score for EM match in 2022 was a 244. And we can like talk about that a little bit later on if you guys have questions specifically about step 1 versus COMLEX and all of those things like that. When it comes to research and your involvement, if you like it and it's something you enjoy, you can do research for your CV and other things. A publication of like 1 or 2 is good, just so you don't have that section blank. I think I have like 3 on mine, and I'm pretty comfortable with that. I'm not really a big research girly. It's not something I really want to do in my future career. But if that's something you like, dive into it. If it's not, don't stress. If you're like, oh gosh, I'm not getting in the lab, I'm not doing research, it's okay. Just trying to find ways to be involved, do a survey, write a paper, do something just so you have something on that resume. This one is a big one. Follow EM programs on Instagram. I actually did this after I attended conference my 1st year, and it's so cool. They post stories about what their residents are doing. I see them like out to brunch, and you can kind of get an idea of the culture of that program before even stepping in the door. And it also gives you something to talk about. There's a lot of programs that are now on my list that weren't on my list because I'm like, wow, their residents look like they're really close, or wow, that was a really cool sim lab they did. I saw one program that did like a really big triage like sim lab, and it was like, oh, that was really cool. I would love to be involved in something like that. So follow them on Instagram, do your research. It's cool to kind of get in the door beforehand. Med Twitter is a big one. There's a lot of programs and residency directors that use it. They post updates. It's a great way to network and communicate. And that's really a big thing that I wish I stressed more as I got into it. And it wasn't until I started attending conference that I was like, oh, I should network. I should get to know these people. I should see what's going on in the world outside of just my institution. So if you're not on Med Twitter, you should get on Twitter. I guess it's X now, but same thing. And then learn Spanish as much as you can. I learned this the hard way in OB. My community where I'm at is a very high Spanish speaking population. And one of the first questions I was asked was, do you speak any Spanish? And I was like, no, I took German for 2 years and I don't remember anything. But that's something, even if there's like Babbel, there's a bunch of different things that you can just, if you're walking around or have extra time, learn some medical terminology in Spanish. It can really, really help you stand out. And then take opportunity to do any clinical work and procedures. This is both when you're in your preclinical years and in third year. If you see there's an ultrasound clinic that your school is having, go to it. When you're on rotations, if someone asks you to suture it, asks you to do something, do it. I found that being able to be comfortable with that kind of scary, like, oh, am I ready to do this? Get comfortable kind of jumping into things. Because the more hands-on experience you have, EM is very procedure heavy. The more suturing you can get, ultrasound, you can get intubations, things like that are really, really going to help you down the line.
Also, a quick note about the social media thing. For me personally, I made like separate accounts for Instagram and Twitter to follow programs and stuff just because I don't know, it's more professional. So do that if you want.
Yeah, I see like a lot of people kind of having like a professional account versus like a personal account, which is also really smart.
So for you first years on here, which I think is probably a majority of you, things that you can do now that will help progress your journey through EM is to join national organizations like so thanks for hopping on. You've basically already joined. And there's also other EM organizations like ACEP, EMRA. We'll talk a little bit more about these organizations at the end. Join your school's EMIG if you haven't already. I'm assuming most of you are part of your EMIG, or else you wouldn't have heard about this talk today. And usually board elections happen around this time. So if it's still open, apply for a leadership position. If it's already closed, that's okay. Try to be on a committee and just stay really involved with your board. And like Sarah was saying, do all of your skills labs, go to the sim events, and really get to know your surrounding EM residencies. Like me personally, there's 3 or 4 like right around my school, and I've gotten to know a lot of the people at those programs. And I did like a shadowing shift, and I went to one of their journal clubs. And so really get to know them. And one of the best ways to do that, like Sarah said, is to follow them on Instagram and reach out to people that have graduated from your school that you know are in these residency programs. Focus well on your didactics. You don't have to worry about boards too much yet. Just do well, focus on the now, get through it. Not as fun. Third year starts being more fun, I promise. Find out who your school's emergency medicine director is and get to know them if you have one. For me personally, I meet with mine like once every 6 months or something, but he's going to write me a letter and who knows, it might be useful. So it doesn't hurt to get to know them, even if you don't interact with them that much. Get involved in any volunteer clinics that your school has, any shadowing shifts that are offered. And also, like I said, you can reach out to students that graduated from your school that are in a residency nearby and just reach out to them. I'm sure they'd be more than happy to have you shadow. And then lastly, find a mentor. Find someone at your school, find someone on a national board, anyone that's willing to mentor you, a resident that you know, a physician that you know. Myself, Sarah, and anyone on our board is more than happy to mentor any of you guys. We'll have our contact information at the end, but just find someone that you can reach out to for advice, because you'll find that your school is not going to provide all of the information that it takes to be successful. So it's just really good to have that connection when you need it.
Yeah, if anyone's familiar with RAM clinics, I know they're really big in the state of Tennessee. We have a lot of like rural underserved populations. That is an incredible thing you can do. It's a lot of clinical experience. All you need is a doctor to kind of oversee you. So talk to your professors, see if they are interested in that. A lot of docs around at least my area are really involved in that. And it's a really great way to just see some quick fire pathology and learn from people, get comfortable with physical exam, get comfortable talking to people, get comfortable presenting, which is a huge thing third year. So RAM clinics are also a really great thing when it comes to volunteer clinics. So looking into second year and beyond, what you should kind of be tailoring your efforts is to taking leadership positions. Leadership is really big in your applications, in being a physician in general, because you are a leader of a team, especially in such a team heavy specialty like emergency medicine. So if you're on an EMIG, try to get on the board. I wasn't a president or anything like that, but I held a position. Try to get involved in national organizations like ACOEP, all the other things. We have a big list coming up of all the different organizations. Show that you kind of have an initiative to lead and be a leader. take on a project, pioneer an idea, have something that kind of shows that I'm a go-getter, I'm willing to kind of go the extra mile, lead, and put in a lot of effort. That really shows when it comes to being involved in something, to see the progression of kind of a member to more so a leader in that organization. Second year, you're going to be diving more into your didactic years. You get that nice foundation with all your biochemistry, gross anatomy first year, and then you actually start applying it second year. You can focus on getting good scores, especially in your classes, get that GPA if that's something that your school does. And then also, and I wish I would have taken this advice sooner, incorporate step 1 level 1 questions into your studying. I didn't start using things like UWorld or ComQuest until about halfway through second year. And I was like, oh my goodness, I wish I would have done this when boards came around, because that's kind of a core part of your studying. So start seeing the way those vignettes are worded, because it'll really, really help you down the line, and also challenge you for your specific institution exams as well. Third year rotation options, I think it varies from school to school, but try to secure a place that has an EM residency associated with it. It'll help you in the long run. Me personally, all of our rotation sites didn't, but I'm in an area where there are some at my disposal, and then also being involved has helped a lot. And we're going to have some mentorship series down the line about second year and kind of what you should look for with CVs. So be on the lookout for that. Same thing with the month after that, we're going to have a how to succeed in your clinical years. So how to do well on your rotations, how to do well on audition rotations, things like that. So be on the lookout. But for third year, there's other electives that you can consider to kind of get more tools in your toolbox for when you go on auditions. Anesthesia, get some intubations in. Cardiology, I am so happy I did a cardio rotation, because when I did my ER rotation, they would hand an EKG and I'm like, I feel comfortable reading this. So being familiar with that pathology. Ultrasound, ICU, critical care, radiology, sports med or ortho, or just something that you enjoy. It's really cool to kind of have different things. I think I did an ophthalmology rotation, and that having that little toolbox is kind of cool when it comes up. So just do what makes you happy. Enjoy third year. Like Amber said, the grass is greener. So any first and second years on here, it's really, really fun. It's a lot of work, but you will enjoy it. EM as an elective third year, this is a great idea to get your feet wet, learn how an emergency room works if you've never worked in one before, get used to the pathology and how things are kind of built. If you can't do an EM rotation your third year, it's okay. I know a lot of people who haven't, and they did just fine. A lot of places do only wait until your fourth year to do it. I was lucky that mine allows third years, but if you can get a rotation, it's great. I know my school uses Clinician Nexus, like Amber mentioned, to kind of get those electives down. So you can also look on there when the time comes. And then dive deeper into your extracurriculars, continue volunteering and growing in whatever interests or hobbies you have. If you find yourself sitting second year and being like, I don't really do much outside of this, find something, go do something fun, find something different that you can talk about in your interviews, because they want to see that personality. They want to see that you are someone outside of that white coat.
So we keep saying getting involved. What does this mean? There's a lot of ways that you can get involved. We really stress the importance of quality over quantity. EM residencies want somebody who pioneers a project, takes on something, and sticks to it, rather than having, oh, I volunteered at a soup kitchen, I walked a few dogs at a dog shelter for a couple months over the summer. Pick something and stick to it, and try to grow as an individual within that hobby or whatever you're involved in. So professionally, you can get involved with large organizations like ACOEP, ACEP. You can go to conferences and, like we said, be a part of leadership. Volunteering, I wish I would have kept track of this like as I did it, rather than trying to remember and go back and find emails and dates. So just keep track, jot it down. If you have a growing CV already, then that's perfect. You can add to it there, or just keep it in your notes on your phone, like what you're volunteering, what days and years and months and whatnot. And like I said, just pick an opportunity or two and be consistent with it. As far as being involved at your school, you can be a part of EMIG. If your school is an ultrasound club, join that. Join any leadership roles, and then most importantly, anything that you're passionate about that you want to be involved in, do it. Have a life. Bake, kickbox, go to concerts. I go to music festivals all the time. Travel, whatever your heart desires. Craft beer like Alex. And then, like we said, research. If you like research, do it. I personally have like 2 articles that I have on my CV so far. Giving presentations and oral lectures also counts. You can add that. And that's about it.
So CV basics, we're not going to go into a really deep dive about formatting, things like that. If you have questions about that, let us know, or reach out. That's what a great thing about mentors is. I mean, Alex sent me hers the other day. Like it's huge to kind of see things. But the biggest thing is keep track of your dates and build as you go. You'll be shocked how much you forget. No, I'll remember to put it all in when the time comes. Time flies, and then you're sitting there like, oh, what did I do first year again? I know me personally, I had a running Google Doc, and anytime I did volunteering, if you don't log it on touch hours, which some of us do, or I did any type of involvement or anything, I would keep a running list with the dates too. Make sure you save the dates because it's really, really hard to look back when you're exhausted in third year and being like, what year is it? Where am I? When did I do that? So making sure you keep track of that. A running Google Doc is fine, and then you can format when the time comes to actually use that CV. Reverse chronological order. On all your CVs, I like to format that Google Doc that I was talking about in that order so I can add as I go. Remove shattering, the here and there volunteer events. Don't really put in a lot of high school events. If you're ever questioning, like, should this be on my CV, always reach out to somebody. I think everyone on the board would be more than willing to give honest feedback. Reach out to your mentors, reach out to other doctors you had. I'm in surgery right now, and I had my surgeon look over it, and she was like, this, you shouldn't have this on here. It's not of value. So it's getting that feedback is nice. But some things to consider, and this is how I think you guys should kind of be looking at how to tailor those first 2 years. You're going to be putting in your education, work experience. If you were a bartender, put that you were a bartender. If you worked at Sky Zone or you did something, put it there because you never know when it'll come up in conversation. I had a friend, he was a waiter for like 4 years at this steakhouse, and he was asked that on his interview for like 25 minutes. And they're like, oh, I love steak. Like, that's my favorite restaurant. So you never know what'll come up. Leadership is big, all your volunteering. And it's always good to kind of put a blurb about what you did. We helped package food for a nearby food pantry and delivered it to people for meals. We served the community and did this and that. So having a little blurb there too will help you as you go back, and it'll save you a lot of time in the long run. Publications and research, if you're wondering how to kind of cite those and have those in a correct format, I know their AAMC does have a template of like a CV, and they have how you can kind of tailor like a lecture versus a paper versus any type of laboratory research, but then also like you can look at other people's CVs as well and always reach out if you have questions. Certification and skills, this is going to be more so as you get into third year, so your ACLS, BCLS, all of your past boards, things like that. Honors and awards, even if you think it's small and you were like student doctor of the month, put it in there. You never know if it'll come up. And then the hobby section, which is always the most fun part of it. And I think it's a great place to kind of add some personality. I mean, because we're all students, we all take tests, we all do volunteering, we all do this and that, but you might have something on there that'll spark someone's interest. I think for mine, I'm a big foodie. I have like a food Instagram account. I like go around Nashville. It's called Lunch on Loans, shameless plug. But that's something that I'm really passionate about, and I'm excited to talk about that hopefully in interviews because I could talk about it all day. But I have just, this is by no means like a full CV, but just an example of kind of how these things are structured. So as you're going through these first 2 years, if you had something like I was doing, I worked as a cycle instructor, kind of put some of those things down there so you can keep track of them later. If you had a volunteer experience, put a little blurb. It'll help you in the long run. So this is kind of how it would be structured. And you can see like the hobbies down here, craft beer, that it's a fun thing to talk about on interviews and such.
So here are some of the common organizations that you guys should know. So ACOEP-S. We also have the RSO board, which is a subgroup of ACOEP, but we're all together as one. SAEM is the Society for Academic Emergency Medicine. ACEP, American College of Emergency Medicine Physicians, which also houses EMRA and CORD. AAEM is the American Academy of Emergency Medicine, and they also have an RSA. You should be a member of all of these organizations. Put it on your CV, show that you're up to date with all of these organizations and you kind of know what's going on in the emergency medicine world. We also put a plug for the EM Over Easy podcast on the bottom left. We can talk more about podcasts if you guys have questions about that. It's kind of a good place to get up-to-date news and keep up to date on topics.
Yeah, I'll definitely plug us, of course, but also Emra. Like when you join Emra, they send you this cute little box, and they have like I have like some of my stuff here. They have like I use this antibiotic guide almost every day in my internal medicine, so they'll send you like a bunch of stuff for free, just for joining. So you'll get like all the cute pocketbooks for 30 rotations, and it's great. So join all of these if you can. A lot of them do have a membership fee. Double check with your emigs. I know that mine covers, I think, EMRA, but I could be wrong. Some of them may cover some of them if they have it in the funding, but join them, you might get some free swag. And we all love free swag.
The membership fees are usually pretty cheap. They're not too expensive for medical students. And then for all of these organizations, they all have their own respective conferences. So there's definitely lots of opportunities to attend conferences throughout the year.
For sure. And speaking of conference, why should you attend? So I think this slide was super important because I know when I was a first year, I didn't know what conference was. I thought it was only for the physicians. I was like, medical students don't go to conference. That's just not a thing. It is a thing. And it was one of the most valuable things that I've decided to do because it brought me here with all these wonderful people in the bottom right corner. But conferences are open to medical students. I know personally for ACOEP, shameless plug, our conference is in Orlando in the spring, and then we're also going to have one in the fall. And you'll have the RSO portion, which is going to be encompassed with skills labs. So you can see here we have some chest tubes, we have central lines. It really gives you some hands-on experience and also things to talk about on interviews as well. These are usually resident-led, so then you also get some interaction with residency programs. The lectures that are in the conferences, especially for ACOEP, are really fun. They're student-oriented and also resident-oriented as well. Some of the cool ones we have in the conference in spring, we're going to have a snakes and shark and alligator lecture for Florida. We're going to have an EKG lecture. We're going to have a really cool triage skills lab. So it'll be really, really fun. We have a Disney lecture about talking about injuries in Disney. So it gives you an opportunity also to kind of hone in on some skills and learn a little bit, especially if you're a first year, just go. I know my first year, I was like, oh gosh, there was like a syncope lecture or something like that. I was like, I don't know any of this, but it's really cool to get your feet wet and kind of see if you can tag along with it. But they're really, really good lectures. So spring is going to be great. Everyone should come. It'll be great. Residency fairs is a really huge part of conference. So the way it's set up is you have a bunch of tables of residency programs in the area and beyond, and you can go up to them. They tell you a little bit their spiel about the program, and then you get FaceTime with the PDs, with the chief residents, with the residents who are involved. And this is huge. This is where your networking comes in. I know that I have program directors that I met first year that now I see a conference and they're like, hey, Sarah, what's up? How are you doing? How's third year going? How's second year going? So it creates a relationship that you wouldn't have had in the first place. And so when they see your name pop up on that application, they're like, oh, I know Sarah. I saw her at conference. She was very involved. She was sitting at lectures and seeing things. So the residency fairs are huge to kind of get your foot in the door early and show them like, I'm interested in emergency medicine. This is something I want to do. And they really respect that. The biggest thing though, networking and mentorship. I know for me personally, we have an EMIG, we have and kind of EM director, but that's really about it. So having people like the fourth years and residents on the board has been absolutely critical for me. I literally FaceTime Alex the other day when VSOL opens. I was like, am I doing this right? If I click this button, like, will it just like kick me out? So having those people on standby that you can just talk through, have them read through your CV, have them read through your personal statement, ask them about how you should be tailoring your residency list, ask them about, do you think I should take boards? What do you think I should do for this and that? Mentorship and networking is huge at conferences. And this is where you meet people. And then we also have social events. It's really fun. I mean, Orlando's going to be great. We're going to be in Texas next year. Past ones have been Las Vegas was really, really fun. We had to do like a rooftop kind of cocktail hour. There was food, free food. So it was a really, really good time. So if you haven't gone to a conference and you thought you couldn't before, you definitely should, because you have so much room to meet people, get resources, get information, and really dive into the EM world. And then also join organizations. Like we have our elections in the fall at RSO, and that's how I got my position, which I would have never known about if I wouldn't have gone to conference. So definitely come to conference. Spring is going to be great. You should all come. And yeah, shameless plug. Okay. And here's some more pictures from conference. You can see we have ultrasound. I think the skills labs, we're going to have ultrasound, intubation. We're going to have a priapism lab, which will be really fun. We're going to have the triage lab. So there's going to be a bunch of hands-on stuff. And this is with residents too. So that also gives you a networking aspect as well. So you're not only practicing skills, but you're also getting to meet people in the process. And then that's something you can talk about. Or when you go on rotations, you've done ultrasound, you've done chest tube labs, you've done central line labs, and they can really kind of make you stand out on these auditions. And then also in your clinical years as well.
Also, don't be afraid to go to conference alone. That's actually how I started because I was the only one like in my friend group in medical school that was totally EM bound. So I was like, I'm booking my flight, I'm going by myself, I'm gonna meet people, have a great time. And that's how I got to know the current board, and then I applied for a position in the fall. And it's all just about taking that leap and, so don't be afraid to go by yourself. It's always nice to have a buddy, obviously, but
And everyone's
you'll
really
make
friendly.
everyone's really nice
So
and
nice.
inclusive. So
Ball.
as far as our upcoming events, so in March, we have a mentorship series about clinical rotations. So, which ones to do, how to do it, how to build your CV. This is geared more towards second years going into third year. And then in April, we're going to have a mentorship series, how to succeed on away rotations. So, this is geared towards third years going into fourth years. And follow us on Instagram. We post all of our updates on there about conference. We'll post about our leadership positions when they become available and any updates on there.
Does anyone have any questions, comments, concerns, compliments? I know I haven't been able to look at the chat yet, but if anyone wants to unmute too and ask any questions, feel free. And then I'll also put up, so this is our contact information. Please feel free to reach out. It's all about paying it forward. The fourth years have been such a resource to both me and Amber. So anybody, first, second, anybody, please reach out if you just need a mentor, if you need help finding a mentor, if you just have a question that you don't want to ask in the chat or on the mic, reach out to us. We're available. And then also this QR code is kind of it goes directly to our doses. If you have any lecture topics that you want to hear about, if you want to know about what should I be looking for, how do I kind of start the process of picking a residency, anything like that. If there's something that's not covered in the mentorship series that you guys would like to see covered, scan the QR code and let us know because we can definitely kind of tailor it to what you guys want because at the end of the day, we want to be helpful to what our organization wants.